Hi, welcome to Fast Facts with Dr. Tan. And today we're going to talk about a very interesting topic, which is getting HIV from human bites. Now, we got the inspiration for this topic because there was a paper published rather recently in July of 2020, right in the middle of the COVID epidemic, and was a case report on a man getting HIV from apparently a human bite. So let me tell you about this case first. So, the victim was a 42-year-old unmarried man, and he got into a fight with his friend, who was an IV drug user and is known to be HIV positive. Now, during the fight, the man was bitten on the ball of his left hand, and it was quite a deep bite. There was a bleeding and gaping wound, so he was attended at A&E. No suturing was required. It was cleaned up. 7 days after this fight, he actually got a test for HIV and was negative. But then he started to develop symptoms, and 97 days, so that's more than 3 months after the fight, he got tested again and was found to be HIV positive. So the victim, this 42-year-old man, swore that he did not do anything that put himself at risk between the fight and the bite and the time he was diagnosed. So from this case report, apparently this man did get infected with HIV from his friend via a human bite. This actually flies in the face of a lot of what we understand about how HIV survives in the mouth, because HIV is not supposed to survive in the mouth. The cells that contain most of your HIV virus, these mononuclear cells, they die very quickly in the mouth because saliva is hypotonic, right? It is a very low concentration. Now, it's theorized that if 3 criteria are met, there is actually a risk of getting HIV via human bite. The first would be the aggressor, the person who bites, has to be obviously HIV infected. Not only that, untreated and have a high viral load, so a high amount of virus in his or her blood. The second criteria is the bite has to be really quite deep enough to draw a significant amount of blood. And the third criteria, and apparently the most important criteria, is there has to be some blood in the mouth itself, the mouth of the aggressor. So it can't be just pure saliva, it actually has to be saliva mixed in with blood. So how does this affect practice? You will notice that a lot of doctors, when patients talk to them about getting HIV from a human bite, in the context of getting post-exposure prophylaxis, PEP, most doctors would tend to brush this off as a very low-risk event and not give the PEP. But it seems that if these criteria are met, then maybe as doctors we should reevaluate the situation and take each case on a unique basis, and maybe if this criteria are met, the patient would need PEP. So very conveniently, this paper also summarized all the 10 other case reports of people getting infected with HIV via human bite. So I'm not going to go through every single case. I'm going to pick out a few that I thought were quite interesting. In 1996, a 91-year-old man was getting robbed by a female sex worker. Female sex worker is known to be HIV positive. She had a lot of dental problems and bleeding gums. And during the robbery, she actually bit him on his hand, arm, and leg. And it says here that he has severe tissue damage, obviously very severe injuries. And unfortunately, the man was diagnosed HIV positive within 6 weeks of the bites, and this was confirmed on the DNA testing. Now let's look at another case, which is honestly quite sad. The victim is a 59-year-old lady who was bitten on the hand by her son, who actually had epilepsy and was having a seizure. So obviously, the son was HIV positive. He was having a seizure and therefore had blood in his mouth. And while she was trying to help him, she suffered a deep wound on her hand, actually requiring stitching. And then again, she developed symptoms about 40 days, about 6 weeks later, and was diagnosed HIV positive. And this was also confirmed on the DNA testing. Another case is a married man, 44-year-old, who actually got into an argument with his foster son. Now, the foster son was known to have good oral hygiene and no bleeding gums, right? But the bite was so severe on his left thumb that the foster father actually lost his nail and had a very raw wound on his thumb. And 28 days after the bite, he had a test and was diagnosed to be HIV positive, again confirmed on DNA testing. What can we learn from all this? I think the takeaway messages are a few. Number one, getting HIV from a human bite is still an extremely rare event. Right? Number two, if the 3 criteria are met, which is the aggressor is HIV positive with a high viral load, there's blood in the saliva, and the bite is really deep, causing a bleeding wound, there is a chance of getting HIV from a human bite. Right? So if this would have happened to you, please don't panic. Please have an objective conversation with your doctor about PEP and listen to his advice. This is Dr. Tan signing off.